Hello and welcome to Age of Grace, a podcast dedicated to everything that matters to the elderly. I am your host, Kumaran, and this series is brought to you by Happiest Health. Aging is a journey. Like any journey, it comes with ups and downs. Today, we are focusing on a very critical issue: geriatric fractures. Why do they happen? How we can prevent it? And what should families know? To guide this conversation, I am joined by Dr. Prasad J, consultant in Rehabilitation Care at Athulya Senior Care, Bangalore. Dr. Prasad is a physiatrist and helps people with rehabilitation and leads a team of physiotherapists, occupational therapists, and speech and swallow therapists. We welcome you, Doctor.
Yeah, thank you.
Doctor, so to begin with, in your specialization, why are geriatric falls a leading cause of mortality in older adults?
Yeah, compared to a younger population and geriatric population, they tend to become less active over the years, and they due to further comorbid conditions, like they might have had a stroke or a previous history of fractures, and also generally over aging. Everyone there is loss of calcium, vitamin D, and bone mineral loss happens over the period of time.
Okay.
But if patient already has some history of fractures, and means it is even more exaggerated. So geriatric population, they also have further ailments like vision problems will be there.
Okay.
There will be problems in their walking gait. So these will add on to that fracture risk,
Okay.
and that healing capacity also will reduce over the period of time compared to the middle-aged population and adult population. In adult population, healing after a fracture is also delayed.
Oh,
Yeah,
okay.
that issue.
So, Doctor, so when we're talking about this, it brings to a very important question. What are the main reasons elderly people are more prone to bone fragility and why?
Yeah. So most common cause, if we tell, it is osteoporosis,
Okay.
which means there is bone mineral losses happening. Mainly bone mineral density is reduced. So why this happens is in normal body, normal physiology, what happens is there are two cells. There are certain types of cells which will increase the bone, like bone cells, and some cells which will reduce the bone cells. This balance happens normally in everyone. But what happens is certain hormonal changes and physical activity even. These factors will affect this balance. And over a period of time, this will reduce. This balance will get reduced. Bone forming cells will reduce, and that bone destroying cells will become more.
Okay.
That's why this osteoporosis happens.
Okay.
So what we generally advise is after 55 years or after 60 years, it is better to get a bone density scan.
Okay.
To done, just to have a baseline measure. How much is the bone density for a person?
Okay. So who does this bone density test?
This is a scan which is available almost in every hospital, corporate hospitals. It is there.
Okay.
So this scan, this costs around 5,000 to 6,000.
Okay.
And this gives a baseline idea.
Okay.
It is a whole body scan, and mainly we look for the hip site because it is more common in the hip fractures are more common in elderly.
Okay.
That's why we check for the hip region.
Okay.
And spine region. These are the two things we usually see.
Okay.
And if that shows there is minimal reduction, means we'll start with calcium supplementation, vitamin D supplementation, and we'll review again after 6 months. Okay. Yeah. If it is normal, it is advisable to do every 2 years.
Okay. So which are the age groups that need to be focusing?
Ideally, 55 to 60 above, we tell that. But in some cases, we should do it before also. If there is a history of fractures, a person is 40-year-old and he has already had a fracture, and we want to know whether any further risk is there, then we should be doing that. Okay. Even before going for the hip fracture surgery or something, we'll be doing that scan. Okay. So that we will know whether to start mobilization after the surgery.
Doctor, so when we are talking about this elderly, and when you said the age group of 50 to 60 can go for bone density testing, we often are seeing younger people are also prone to fractures in some communities, maybe in Indian scenario or in an Asian scenario. So why do you think so?
So this, we cannot tell a single cause for this, but multitude of factors play a role. One is obesity, diet factors, and westernization. More westernization is there. Plus another thing is diabetes, young onset diabetes. Usually, if you see 10 years back, 20 years back, diabetes happens usually after 25 years, or it will happen before, like during birth only, type 1 diabetes. Patient will be on insulin for a long time. So, but nowadays, what happens is this type 2 diabetes, it's even 15 to 18 years of age also, diabetes is happening.
Yes.
And this also will contribute to this.
Okay, so you mean that diabetes is linked to bone frailty?
Not
or
only
fractures?
diabetes, because diabetes also has certain genetic relation
Okay.
plus physical activity. Physical activity is the main contributing factor. Reduction in physical activity, even jogging. So we advise not only regular walking, because nowadays people are telling 10k steps is enough.
Yes.
So that is also is a misconception.
Oh, okay.
So 10k steps, how fast you do, that is also is there.
Okay.
And along with that, we recommend at least 30 minutes of resistance training with the dumbbell. It can be very less weight, 1 kg, 2 kg, or you can use a water bottle which is filled, 1 liter water bottle. You can do with that.
Okay.
So that helps more in this preventing bone loss.
Okay. So we'll come to the prevention a little bit later. We also wanted to talk about why these fractures are happening at the elderly. Many Indian homes are really not aware of a concept called baby proofing, or when it comes to your senior proofing. How do we keep homes safe from falls? That's a very big question.
Yeah. So we'll start with what are the factors which we have discussed before.
Yeah.
So first I told diabetes. This diabetes has issues with vision. Vision loss will be happening.
Okay.
And their sensations also will reduce.
Okay.
And just like when we walk barefoot, we'll be able to feel the floor. But in case of diabetic plus elderly, that sensory loss will be reduced. That sensations they won't be able to feel. So that also takes another risk factor for falls.
Okay.
So if you see in any house, usually there will be marble tiles will be there, slippery tiles will be there. So whenever we see a patient, we advise this also. Family members we involve in the treatment, and we will advise them they should use anti-slippery mats and lighting also. It should not be dull. There should not be any blind spots. It should be well lit environment.
Okay.
So and also better to avoid steps also.
Okay.
And if there is already risk and patient is already been operated before, we advise them to use a walker also inside the home.
Okay. How do we create this awareness, doctor? So there's a much awareness on babies and baby proofing, but how do we start this movement of senior proofing homes?
So actually, this is awareness is coming up now. There are certain facilities available where senior proofing is already been done, and people are living there.
Okay.
And there are apartments coming up with senior proofing. But one thing is usually patients' families, they will come after a fracture has happened.
The fall has happened.
Yeah. And they will come and ask what to be done. So that is, so already issue has happened. So main thing is prevention. We should educate them more on this mainly.
Okay. So the very next question that you were also talking about some time back about 10,000 steps is a misconception, but you need to do it with a regular pace.
How fast you do is important.
Yeah. So this brings to another question of how is exercise, diet, and all of this to maintain your bone health in elderly, for that matter. So because when you say resistance training, light dumbbells can be lifted, or a 1 liter water bottle. So what are the tips like this, if you can suggest us?
Yeah. So generally what we tell is for a normal individual, normal middle-aged individual, we will tell 45 minutes of physical activity.
Okay.
Daily and at least thrice per week of resistance training. But this cannot be applied for a person who is above 65 years of age. So in that case, we advise 30 minutes of aerobic. It can be jogging, cycling, or walking. And this is 4 times a week. And apart from that, 3 times a week of resistance training.
Okay.
But here, mostly we advise at the home, whatever weights are available at home, 1 or 2 kgs or a water bottle, they can lift. This is the main thing we advise. Okay. Diet, if we see, that also defines if protein requirement is there. In adult age group, protein requirement is very important. We advise 1 to 1.2 grams per day, per kg per day. Suppose if a patient weighs 80 kg means 80 grams of protein has to be included. And it is not a single diet. It should be split into 3 or 4.
Okay.
So per meal, 30 grams of protein should be incorporated.
Okay.
Yeah.
Okay. So apart from this protein induced or protein diet, anything else that elderly needs to look out for in terms of
Mainly
diet?
after the 60 years of age, we should have a baseline bone mineral density as well as calcium vitamin D levels.
Okay.
And if there is a significant reduction in that, we advise them to take supplements for calcium and vitamin D. I am not telling the dosage now, so that patient should not be misunderstood with that.
Okay.
It is ideal to go to a doctor and get the prescribed dosages.
Okay. Doctor, so this brings to another question that we often keep talking about osteoporosis and everything. Are women at more risk for bone frailty?
Yeah. So previously I had told you osteoporosis, one factor is hormonal factors.
Yeah.
So in women, mainly after menopause, what happens is there is a specific hormone called estrogen. This hormone regulates the bone remodeling, that bone forming and bone degenerating action, this balance. This is mainly regulated by estrogen. So this is reduced after menopause. So that's why what we tell is we advise women to take calcium supplements in 50 years of age group, so that by the time they attain menopause, we'll be tackling that. So most commonly, physical activity should be continued prior from 30 years of age only. This should be incorporated, daily physical activity, and if required, there are certain measures, interventions for like hormone replacement therapy is there to supplement the estrogen, so that this bone loss will happen at a later date.
Okay. Okay.
So if you see, compared to men, women are at more risk for osteoporosis.
Okay. Okay. So you were also discussing about the bone density test that we need to do. You also said that before hip replacement surgery as well, you guys test bone density. Let's talk about this hip fractures, doctor, because it's something that we have been hearing a lot of it, and it's one of the biggest or number of people having hip fractures are too much. So what do you have to tell about it, and then why does it happen?
So if you see, most of the some patient, some persons will be bedridden at home, and sometimes early morning they will wake up, they will fall from the bed and hip fracture would have happened. This is the most common scenario. In some cases, persons with osteoporosis, they will be walking normally. Suddenly one day they will tell, I have hip pain, right hip or left hip. If you take X-ray and see, there will be a fracture. So this stress fractures also can happen. So this fractures most commonly, if you see in elderly, hip fracture is more common. But replacement, if you see, we won't do for everyone. So it is only done based on their functional status. So after the surgery, whether they will be able to at least stand, make few steps. So for that only, we advise to do bone mineral density prior to the incident only. Like if a fracture has happened, immediate hospitalization, we do the scan. We'll check the status. We have to correct that first. Then only we should go for the replacement.
Okay.
And before the fall, what is their functional status? Whether they were walking or bedridden. That also plays a role. Another thing is whether patient has diabetes or not. If uncontrolled diabetes is there, if we are doing a surgery, then healing process will be delayed again.
Okay.
That issue is also there.
Because we see that the moment hip fractures happen, only after that everything starts. Because as you said, people become bedridden, then bed sores, and everything starts from there. So what's the recovery looks like, doctor, for people with
hip fractures? So it depends upon the comorbid conditions, how many.
Okay.
So if only because of osteoporosis this hip fracture has happened, means recovery is good.
Okay. And
patient's ambulatory status before the fall, if they were active, then it is more likely chances are there they will be able to walk. If the patient is already bedridden and then they had a fall, fracture is there, and we are doing a replacement, means it is chances are less.
Thank you so much, Dr. Deepak, for such good insights on geriatric fractures. It is clear that protecting our seniors from fractures is not only about treatment, but it's all about awareness, prevention, and family support. For listeners, remember, small changes at home paying attention to diet and exercise and regular checkups go a long way toward healthy aging. Thanks for listening to Age of Grace podcast. Until next time, take care and age with dignity.